So, my name is Anne Marie. I'm a professor at Simon Fraser University. I'm trained as an epidemiologist, and my area of research is lung cancer and how we can prevent lung cancer, which is why I'm very interested in radon gas, because it is actually the second leading cause of lung cancer. If people don't smoke, it's actually the leading cause of cancer. So I'm part of a national program. I represent people in BC, and I help provide people with 100 free radon test kits, which is a program that we started with federal funding to encourage people to learn a bit more about radon in their home and to increase awareness, because less than 50% of Canadians still understand that radon is a serious exposure. In British Columbia, we have regions that are quite high. Over time, more people are learning, but only 15% of people maybe have tested their homes. And the only way that you're going to know if it's in your home is if you actually test. So we provided 100 test kits to Kaslo as a way of getting things going, and I'll be presenting the results of our work. So just to say, the program tests all across Canada. So again, I'm the BC person, but I also work at the BC Centre for Disease Control. But people have tested all across the country. And about now, we've given out about 20,000 detectors, and about 30% of people across Canada have tested above the guideline. We are a uranium-rich country. A lot of uranium mines still do operate predominantly in Saskatchewan, but in BC, because we've had a moratorium since 1986, many of the known deposits which exist in the interior have not been mined. So, amongst the communities testing this year, Rock Creek, Fraser Valley, Kaslo, Nicol. So some of these might be your neighbors, along with the Vancouver Island region, Oliver, all the way up to Atlin, to the far top northwest of the province. And then you can see we've tested communities far across the country as well. So as I mentioned, radon is the leading cause of lung cancer if you don't smoke. If you smoke and are exposed to radon, those two exposures together greatly increase your risk to about 1 in 3. It's estimated that 3,000 Canadians die every year from this. And what is really important to know about lung cancer is as people are not smoking anymore, lung cancer rates are not coming down. And there's possibly many reasons for that, including increased risk of exposure to fire smoke, and other carcinogens like arsenic in drinking water. But radon stands out as one of the clearest known established human carcinogens that lead to lung cancer. So where does it come from? Again, as I noted, Canada is a uranium-rich country, and uranium exists in the ground all across Canada, but there's places where pockets are higher. So to the east of Kelowna and south has been well known for a long time that there is a significant amount of uranium in the ground, and that area goes from sort of Kelowna all the way to almost the Alberta border. The uranium in the ground breaks down over time and it gives off a gas. And in fact, this gas was first discovered in Canada, which was really interesting, by Ernest Rutherford's team. That gas doesn't live very long. It lives for about 4 days, but it's long enough for it to migrate from the soil into spaces above. All buildings can have radon. If it's a barn, a workplace, a mobile home with a skirt around it, a log cabin, doesn't matter what kind of a house you have. The levels tend to be higher on the ground floor or in a basement. And the federal government recommends that all buildings be tested using a 3-month test kit, which is what we provided for free to folks in your community. If the levels are above 200 becquerels per meters cubed, and that's the unit that we use to measure the radiation, it's called alpha particle radiation that's given off from radon gas, then it is recommended that you reduce. Now, 200 is not, that's not actually a safe level. It's just a level at which the relative risk is double. So results of 199 or 190 are still meaning that you have an elevated risk of developing cancer. In Europe, the level is 100. And in the US, it's about 150. By now, everybody that took part in the challenge should have received this result piece of paper either by email, or some people may have requested it by mail. We had 67%. We gave out 100 test kits. 67 people started them. One person it's still outstanding, so that's okay if it's somebody that here that still has it. They're good for up to a year. It just means that they've missed the free give back into the box. We have so far sent out 60 reports. We're still waiting for six of them to come back from the lab. So the devices are sent back to a lab and they're read to see how much radiation has accumulated in the puck over time. These are the results for your community. This information is an aggregate result, so there's no way of identifying anybody's home. And what we see here is the green is below 100. The yellow is the area between 100 and 200, so between what European governments suggest is okay and what the Canadian government suggests is okay. And the discrepancy for that is in part because Canada is a uranium-rich country and they recognize that uranium is present throughout, so it can be harder to get us all down to 100. But we did see a considerable proportion of homes, but and this is why I'm here, between 2 and 600, 600 to 1,000, and then again we saw a few homes for over 1,000. It doesn't radon doesn't differentiate between the kind of home that you live in. What we did, mostly you did have single detached homes that were tested, but you can see more of them were above 200 than less. Duplexes also as well. And then interestingly, you had other kinds of building types, so that include cottages, mobile homes with loose or tight skirting. We did see one above. And then, this is not atypical. We usually find that most people that test their homes are people who own their own homes. And sometimes people just don't provide us with that information. I think for me, what was interesting about the results here in Kaslo is that some people had tested before. And it's possible that these folks that had tested before and their homes were still above 200 may have used a different kind of test kit. The test kits that we provided are the most accurate on the market. You can get digital detectors. However, there are some issues with them, and the government has had to recall some of those devices. Perhaps people were doing a check and make sure. But just to say that there were people already in your community who may have been aware that their homes were elevated. And then this down here, I don't know if the building official is here as well this evening, but there were four people whose homes were above 200 who indicated that they had a radon rough-in system already built into their home. Now, we had only 18 people answer this question because it's often a question that people really don't know about. A radon rough-in system up until recently was just a pipe that went from under the house into the basement of the house, hopefully with a cap on it. And that was to make it easier to put a system in. Over the last few years, that has changed in BC, and a passive stack is a pipe that's had to be built all the way up and out of the house. And then the new building code requires that all homes in BC have that passive stack. But in and of itself, it is not an active radon system. People still have to go and get a fan, which is not particularly expensive, but they have to have the fan put in and turned on for the systems to actually be active. So yeah, these folks are probably ready to go. Like the ones with the passive stack probably just need to put their fan on and why we're building new houses this way is that this makes this turning on the radon system a relatively inexpensive fix. If people have to start from scratch, it can be up to $3,000. So making sure that all our new homes actually have these systems built into them is a really important way that we're going to continue to try and reduce lung cancer going forward. But again, this only 18 people. I kind of play a game where I ask people about their radon system in their homes, and people usually think I mean radar or an alarm system. So it's still not it's still not a well-known thing that people have. This is a community report. So when we're done, we will distribute this. Every community that's part of the test kit challenge will get a copy of this. And it just shows the proportion of homes that were above 200. And you can see here for Kaslo, that was 60%. But again, we don't differentiate between the where of the community where those houses are. And people's data is considered private and anonymous for us. People often ask us if year of build is important with this idea that, older houses are worse, but that's not necessarily the case. In fact, one of my research portfolios is energy efficiency. And what we can see over time is as we're tightening up our homes to address new energy step codes, what we're actually doing is sealing the radon gas in. Homes need to be very carefully balanced to make sure that the radon actually doesn't remain in the home. And that doesn't always happen. So you can see the red is the higher levels, and they are fairly equally distributed. Although if you have an old leaky house, often you don't really have much of a radon problem. So you might be asking me, well, how does my community compare to others in British Columbia? And again, part of the reason I'm here is that, like Kimberley and some other places where we've tested, because Kimberly's tested a few times, we are seeing, nearing 50, 60% of the homes that tested, were above the recommended guideline. So what do people do and how can we help people remediate this problem? In Canada, because radon is a colorless, odorless radioactive gas, people can't tell if someone's fixing it properly. So we really recommend that people get a certified professional. The federal government has a rigorous certification program. People can both measure and remediate, or what's called radon mitigation. There is a website. This is the agency that provides the certification. You can type in your postal code and it will tell you who does remediations in your area. And luckily, thanks to people like Dana Schmidt from Kaslo, there are people who are trained who can come and help people fix their homes. But the CNRPP people are required to have insurance, which is another important factor. So we really do encourage people to consider a professional. You can do it yourself, but for good reason, hiring someone to fix your home is a good step. In other provinces, there are programs to help people offset the costs. In BC, we don't have one yet. I'm working with the BC Lung Foundation to try and set up a program where we can help subsidize. But the National Canadian Lung Association does have mitigation grants that people can apply for. They are income-based. But if you know of people who have tested high and they would like to know a bit more about whether or not they qualify for funds to cover. And again, it's about $3,000 to fix a home, and you can apply for quite a bit under this program. So we really encourage people, seniors or low-income families, this program is a useful one. If you work from home and you want to have a radon test kit in your home or a digital monitor, you can actually apply for a tax credit for that. Unfortunately, we haven't got mitigation covered in the tax credit yet, but this is part of our national advocacy. But you could buy a digital detector or one of the ones that we gave out for free, which is only about $60, and then you can write that off in your medical expenses at the end of the year. I think actually before we move into that, I also would like to just point out that this year, so I work also at BC Cancer, and we have started a pilot program. And if you have a test result above 800, or you know of someone that does, you may be eligible to have a free low dose CT screen. It's a very little amount of radiation. I managed to get the site in Kelowna to agree to onboard people. Over time, we realized that early detection for lung cancer is really the best way to keep people alive after 5 years. The survival rate for lung cancer is about 15% after 5 years. Like pancreatic cancer, it really is a killer. So if people have elevated levels or they're concerned or they've found elevated levels in other ways, not just this program, the BC Cancer has a lung health check study and people can enroll in that. I'm happy to provide information afterwards. It's sort of my other job, so I don't put it in this presentation. But for this year, we have the opportunity to give people some reassurance, hopefully, that their lungs are still okay or early detection if cancer is going to be a problem. Other organizations across Canada have done things after this program to, sort of acknowledge radon in the community, including making sure that radon requirements are clear in building codes and promoting awareness including radon and real estate property disclosure. In British Columbia, if you do sell a home, you are required to discuss the radon levels in your property disclosure. That's very common in Kelowna. But Kelowna, the levels are so high there that people know to ask. Because yeah, we're seeing homes in 3,000 in the Lake Country region. So it can be expensive to fix if you have a brand new fancy home as well. So people know in BC that this is an issue. We are also advocating for coverage in new home warranties. In Ontario, if you buy a new home and it has a radon problem, it's automatically fixed. We don't have that here in BC yet. The federal government has lots of resources. If people are concerned about accurate information, there's lots of action guides and pamphlets for people to access. And then there's checklists if people want to take things on. And I have lots of information I can provide to people. And I think that's the end of it. So I thank you very much for participating in this program and for all the people at the municipal hall who took part and made sure that this happened. I'm happy to answer any questions if I have time at this point in time.
Yeah, I think we'll allow you some time because it's an important topic. And thank you very much, Anne Marie, for your presentation. Are there any questions from council? Councillor Leafwood.
Through the chair, can you test the ground before you build a house?
There,
Or you just automatically put the test kit or the
you
pipe in?
Yes, you can do a soils test for radon. However, how a home is built actually really does influence what the radon levels are inside. Things like meteorologic conditions actually influence radon levels. When there's a low pressure ridge, the gases in the soil are pushed down. And then when there's a high pressure ridge, it draws them up. So until you actually have so you can test, but it doesn't necessarily indicate whether or not it's going to be in your home. The good news, though, is that if you test and then you build a house according to the new guidelines, which includes like a sealed membrane, the new building code includes a gravel, a sealed membrane, and then this pipe. Most of the time, that actually is sufficient to keep levels quite low. So our building codes and our new builds kind of are our biggest asset towards reducing this problem, if they're built properly. The problem being that, new homes are expensive and often people who live in, less new homes or heavily renovated homes might be more at risk, or people who live in basements or have home offices in basements. That's another place we know people spend lots of time in refurbished, renovated basements, and those can be quite high.
Thank you.
It's a
Any
good
questions?
question.
Councillor Bird?
Yes, through the chair. It went by a little fast, but I noticed one of the ways that the Take Action on Radon is trying to address this problem is, yeah, I was learning about public buildings and the requirements of municipalities, like specifically municipalities, to mitigate buildings that they actually own.
Yes, the radon in the building, in occupational health and safety regulations, radon levels in public spaces are required to be 200 becquerels per meters cubed as well. The only place that this really differs is if people are in mines and other places. So for workplace health and safety, especially in schools, or other municipal buildings, yes, there is a requirement, and employees can ask the employer to test a building. The good news is buildings are usually easier to fix, sorry, because they have central HVAC, and sometimes the HVAC can be titrated quite easily so that the radon levels are lower.
You mentioned health and safety regulations for this. We were talking about municipal buildings, but what about private business?
Well, that would be again the employer-employee relationship. So employers can ask if there's a joint health and safety committee. Employers can ask to ensure that their workplace is safe, and that could include a radon test as well. Interestingly, banks have all been tested. There's a number of federally regulated buildings that have already been required to be tested federally. So, and provincially, most of the buildings that the province is responsible for, including all BC housing buildings, now have been tested too. but they're just not very open about that. I'd like to see the results of the testing. They did them in Interior and Northern Health. We just learned about that this year. So we in BC we have the BC Radon Data Repository, the BC CDC. Again, this is a different hat of mine. But if you want to go online, you can actually see by municipality and health region what the average radon levels are, t drawing from tests that have been done historically and then held at the BC CDC. So we're the only province that has a radon map like that. Nova Scotia has something similar, and so does the Yukon, but ours is the most robust. And so it's publicly available. So if you do radon map BC CDC on any device, now we've made it useful for phones. You can see by municipality as well what the radon levels are.
Any other questions? It, I actually have a couple. On the test kits, when we were setting them up, it indicated to put them on the the floor that was most often occupied. Um, so a lot of homes are split level and they have or have two floors, and their living area where they, living, dining, that kind of stuff is on the top floor. And then your sleeping quarters are and home office. I'm talking about my home, just so you know, and it's on the lower level. So I set ours up on the um, main level because that's where we are most of the day. Um, so my reading is for that space. What in is there a general rule about how much higher it could be on the floor that you did not test? Because that would be, you're having guests in your home, and some of them stay for a length of time.
It can be 20% higher in the basement. It depends though if you have a heat pump or how your house is, if you have forced air heating. Forced air heating draws air from usually it's in the basement and then blows it all around. So it can change. A heat pump tends to keep the radon levels similar in all the levels of the home. So most of that research has been done in the UK, but forced air heating provides a different home distribution. And then if you have a wood stove or you heat your home in a different way, then that can also influence it too. But generally, the radon levels in the basement can be about 20% higher than they are on the main floor. But there are that's a real ballpark because maybe you have windows in the basement, maybe you have a different kind of furnace. So all those things the radon levels, like I have one in my house here in Vancouver, and it sort of oscillates around 40, but it can go up to 60 and then drop to 15. Just really the levels change all the time. So that's why we test for 3 months, is that we want to get an average. We don't want to see the worst or the best. We want to kind of get a general sense of what it is in people's homes. But yeah, you could probably expect that what's in your basement is a bit higher than what was on your living space area. Yeah.
Okay, thank you. And my last one is, if we're going to share this with members of the public, is there contact information that we could provide? So, because there are members of the public who do watch our meetings. There's some in the room right now, and there will be people online who might be interested in getting further information, especially if they haven't had a test yet, and they might be concerned and want to follow up.
Yes, here's my email at the end here. Oh, can you see me still? Did I lose you?
Well, we
Um,
can see you, but your presentation is gone.
how's that now? It says continue to share. Can you see that? So this is my personal email. Especially
Okay.
if you're older than 45 for a woman or 55 for a man, and you have had high levels from your home, 800 or above, please email me because I can help connect you with the researchers around the pilot. I went and got a low dose CT screen myself. My parents had a place in Sycamoose, and there's high levels there too. So I went and had a screen. It took really all of 5 minutes. This is also the website for Take Action, but people, please feel free. I am our BC person. So any and all questions, nothing is too strange to ask. I have probably answered your question before with somebody else because I've been doing this almost 10 years now. Yeah, please reach out and I can do whatever I can to help. I can also send the link afterwards to the BC CDC radon map because, again, we're lucky in this province to have that resource. It's used, realtors use it all the time, and public health folks. And I will stop sharing now.
All right. Well,
Okay.
thank you again very much.
Yes.
And we've got the information and I saw somebody writing it down, so it's good. Thanks so
Excellent. And
much.
thanks to the staff too who took on the challenge. I really
Yes.
appreciate all the effort that everybody went to because it's not just a nothing thing. So
Yeah.
yeah, thank you.